welcome to Mom's Heart Suction. This is where we celebrate the incredible journey of motherhood and also provide valuable insights for all our amazing moms out there. Here we also focus on the prevailing issues relating to motherhood, childcare development, and many more. My name is Shalade Kumbofat, the host of Mom's Heart Suction. Mom's Heart Suction is brought to you by Mom's Heart Foundation. Today we have an interesting topic to discuss today, the journey of pregnancy. Most of the times we plan for everything, but when it comes to pregnancy, there are times that people say that it's a mistake. They didn't come prepared. But here we have to plan for pregnancy. We have an expert guest with us who is going to take us through this discussion for us to know whether should we even plan for pregnancy, should we even prepare, is it necessary to do that? Madam Mary Ejari, who is our expert guest, a midwife and a public health nurse, who is going to take us through our topic for today. Madam, please.
Thank you.
How is the family doing?
They are doing well. And how are you doing?
I'm also good. Welcome to Mom's Heart Suction.
Thank you.
So we go straight to our topic for discussion for today. It's the journey of pregnancy. If I may ask, do we even need to prepare for pregnancy at all?
Yes, thank you. Yes, we need to prepare for pregnancy because at the end of pregnancy, we are bringing out a human being. And so the effort we put into pregnancy determines the human being that comes out. Therefore, it is of absolute importance to prepare for pregnancy. There are some steps one needs to take when you are preparing for pregnancy. I have put them under three main groups. The first one will be tracking your menstrual cycle. You know that every month, every lady has a menstrual cycle, and there are times where we menstruate, and there are times where we are in our safe periods, and there are times where we ovulate. We need to know these times, and so it is recommended that for 6 months, anytime that you have your menstruation, the very first day you put the dates down. The day you finish, you put the dates down. Then on the following month, you do the same. It will help you know whether you are a 28-day cycle person, you are a 21-day cycle person, or you are a 35-day cycle person. This will help you to know your fertile days and your safe days. And of course, once you are preparing for pregnancy, you know that intercourse should happen when you are on your fertile days. The next thing,
So can you please let us know what fertile days are and safe days are?
okay. So the very first day you have your menses in the month, that is day 1 of your menstrual cycle. Averagely, every woman have menses between 3 to 7 days. So after the 3 to 7 days, the next 6 days, you are safe. So that's your safe period. Mostly on the 14th day of your first day of menstruation, you are in your fertile days. Averagely, it is from the 10th to the 14th day. So when you want pregnancy to occur, mostly you have intercourse within those periods. That's the 10th to the 14th day of your menstrual.
Which is the fertile period.
That is your fertile period. Then you now move into your safe period again. Then another menstruation occurs. So in order for you to track it, that's why you need to keep track of the days for at least 6 months before you are sure that I know when my fertile days occurs. We have some signs that will also help you to know that you are ovulating. Normally, when you are ovulating, you have breast tenderness. Your breast begins to feel sore when you touch them. There is a slight rise in temperature. So during these ovulation times, you will see that your temperature rises by 0.5 degrees. Then also, the normal vaginal discharge that you have when you are ovulating, it becomes a bit slimy.
Okay.
It thickens and it becomes very whitish. So this one will help you to know that you are within your ovulation period. For some women, when they are also within the ovulation period, they begin to feel very horny and feel for sex. So it's also another sign that shows you that you are within your ovulation period or your fertile period. Then another thing that you need to do when you are trying to conceive is preconception care. Preconception care refers to reviewing all your medical history, your surgical history, your family history, your reproductive history, to know whether you are fit to carry pregnancy. Sometimes we may have medical issues that need to be treated before one becomes pregnant. There are some surgical history that you need to go back to review for you to become fit for pregnancy. You need to also take some medications. We know folic acid is very good when you are trying to get pregnant because it helps in the formation of the fetus. It's found within our diets, but because sometimes it's not adequate, it is recommended that when one is trying to get pregnant, we need to take folic acid at least 3 months before you conceive. Yes. This will help in neural tube formation. This will help in proper development of the fetus so that you can get a proper outcome at the end of delivery of pregnancy. We also need to build up our HB or our hemoglobin or our blood levels. Normally, typically, most women are anemic, and we would not recommend that you enter into pregnancy with an HB that is less than 7. And so we try to tell women who are trying to conceive that you need to take in foods that will help build up your HB. These are found within our local foods. Examples are like our green leafy vegetables, the kontomire, the ayoyo, the alefu. These ones help to build up our HB. Also, we can take our iron supplementations, like the ailerons, like the zincovates, like the zincofa. Once you build up your HB, pregnancy in itself reduces our HB. So once it is built up before pregnancy, it will shoot it up and it will help for a good outcome.
I think you've even answered out my next question to be asked about nutrition. And then, as you were saying, folic acid and then building our blood level is very key. And then you mentioned the green leafy vegetables that we should be taking. So it means that before, as we are preparing to get pregnant, we should be mindful of our nutrition and our diet aspect. We should very be key about it. Is that right?
That is very true.
Okay. Then we move on to our next question. As you are saying, you were mentioning other things when it comes to lifestyle. As you mentioned earlier in your submission about medications and screenings that we have to do, it also boils down to our lifestyle that we live. There are certain habits or characters that we exhibit that should we need to avoid certain lifestyles when we are preparing for pregnancy?
Yes. There are some lifestyles that we should alter when we are preparing for pregnancy. One is smoking, tobacco smoking. Now, there are so many substances that we smoke, and it affects the development of the fetus. Once you have in mind that you are preparing for pregnancy, you should make a conscious effort to quit smoking in any form. We also have secondary smoking. Sometimes you are not the one smoking, but you are always around people that are smoking. It also affects you. It affects the production of your egg. It affects the quality of the egg. It affects how the baby develops. It affects the baby. When the baby is born, it affects its development. And it also affects you. It brings up some medical conditions that hitherto were hidden in you. Another thing is alcohol. We have alcohol. Alcohol can be taken in moderation, but as you are preparing for pregnancy, there is a need for you to quit it or to reduce it to the barest minimum, at least once a week. Once a week, even with once a week, we expect that we take like at most 250 mils.
But is it even good for women to be taking alcohol?
No, but
Or
sometimes
men? Because everybody takes.
yes, and it goes to the men because alcohol and tobacco use affects sperm production.
Oh.
Yes. So sometimes the woman might not be taking the alcohol, but once the partner takes alcohol or smokes, if it affects the sperms, it means that the sperm that is going to fertilize the egg will not be of quality and it will affect the fetus that is being formed. And so we advise that on both sides, we quit alcohol, we quit tobacco when we are trying to conceive.
So does alcohol also contribute to this low sperm count, infertility in women? Does alcohol and smoking, just these two ones, does it really contribute to that?
Contributes. It has a role to play when it comes to low sperm counts. It has a role to play when it comes to infertility. When we are treating infertility, you'll be told that there are some things that you need to alter, and alcohol is part of it. Tobacco use is part of it. Another thing about the lifestyle that we talked about, now we need to be very intentional about sexual intercourse. Once we are preparing for pregnancy, it means that we need to time when we have sexual intercourse. Now, we talked about the fertile days. So it means that we make sure that during the fertile days, we are having sexual intercourse. And sometimes, because some of us do not know our fertile days, we recommend that once we are preparing for pregnancy, it should be 3 to 5 times a week of regular unprotected sexual intercourse. 5 times within a week. Yes.
So it means that your partner should always be regular with you.
Should be available once you are trying for pregnancy, yes.
3 to 5 times. Can it be more? Or can it
It
be
depends.
less?
The less no, but the more it depends on your strength.
Oh, okay.